Hello everyone, and welcome. I'm excited to introduce you to our presentation today titled MedCode Made Easy. This is part of our IP-DRG coding series. Throughout this session, we will explore everything you need to know about inpatient DRG coding, starting from the basics and advancing to more complex topics. We'll also look at real practical examples tailored specifically for the UAE inpatient settings. I look forward to guiding you through this journey and helping you become confident in inpatient DRG coding. Let's get started. Shifting to UAE inpatient, it can often feel like learning a new language, right? We're talking about principal diagnosis, CC or MCC, and the reimbursement logic. These are complex concepts that can seem overwhelming at first. Many of us find ourselves stuck on IP-DRG, especially when trying to navigate inpatient coding. You might be confident with outpatient coding, but as soon as inpatient workflows come into play, there's that hesitation, that freeze moment. It's completely normal. And then there's understanding ICD and CPT codes. They're essential, but they can also seem confusing at times, especially when trying to piece everything together for accurate DRG coding. The key takeaway here is that inpatient coding has its own language and rules. Recognizing that is the first step toward mastering it, and that's what we're here to do, help you feel more confident and understand how to approach these challenges effectively. Let's take a closer look at some of the core challenges faced in the UAE when it comes to DRG coding. First, there's a significant gap in local training resources specifically tailored to IP-DRG. This means many coders don't have the dedicated support or specialized training needed to master this complex system. Next, we encounter reimbursement confusion. It's often unclear how the choices made in coding directly impact hospital payments, which can lead to inconsistencies and financial uncertainties. Then there's the issue of complex documentation. Physician notes, queries, and the assignment of severity levels all add layers of complexity. Properly interpreting and accurately coding these details is crucial but challenging. Another point to consider is that there's no solid inpatient foundation. Many of the rules and frameworks used for outpatient coding don't apply the same way for inpatient cases, which can cause further confusion and inconsistency. Overall, these factors highlight why coders struggle with DRG. The combination of limited training, unclear reimbursement implications, complex documentation, and differences between outpatient and inpatient rules makes accurate coding a real challenge. Understanding these core issues helps us see where improvements are needed to enhance the accuracy and efficiency of DRG coding in the region. Imagine you and a friend both get admitted for pneumonia at the same hospital. Despite having the same disease and being in the same place, the costs can be very different. For example, your friend's bill might be around Rupee 50,000 because they needed ICU care, oxygen therapy, and intensive monitoring. On the other hand, your bill might be only 10,000 since you only needed tablets, a 2-day stay, and routine monitoring. This difference in severity and resource use is exactly what DRG, or diagnosis-related group, captures. It helps hospitals and insurers understand how to categorize cases based on the intensity of treatment needed, not just the disease itself. So, even with the same illness, the costs and care can vary widely, and DRG helps make sense of that variation. So, as we see here, higher severity generally means more resources are needed, which in turn leads to higher reimbursement for the hospital. This is because the grouping system directly influences how much money the hospital gets paid for each patient. That's why accurate coding is absolutely critical. It ensures the hospital is properly compensated for the care provided. Now, the way this works is through DRGs, or diagnosis-related groups. Basically, DRGs categorize hospital patients based on what was wrong, how sick they were, and what kind of care they needed. This grouping helps streamline billing and resource allocation. And remember, this system is built on one core idea. It's a unified system with 4 key factors that determine reimbursement. So, understanding DRGs and their role is essential to grasping how hospitals manage their resources and funding effectively. Let's talk about the high demand for IP-DRG coders in UAE hospitals. As the healthcare system grows, so does the need for accurate coding professionals. This creates excellent career growth opportunities for those skilled in DRG coding. It's also important to note that auditors are very meticulous when reviewing DRG accuracy. They scrutinize the coding to ensure everything aligns correctly, which emphasizes the importance of precise coding practices. Now, if coding is off, it can lead to underpayment or even denial of reimbursement. That's a significant risk for hospitals, making compliance with coding standards absolutely critical. Finally, let's connect this to the bigger picture. UAE hospitals rely heavily on IP-DRG systems for inpatient reimbursement. Accurate coding directly impacts their revenue, helps maintain compliance, and supports quality reporting. So, understanding why DRG coding matters here isn't just about technical accuracy. It's about ensuring financial health and high-quality patient care in the UAE healthcare system. Now, let's explore some practical examples and tips for documentation when it comes to inpatient coding in the UAE. We'll look at real case scenarios to better understand how selection rules, complications, and comorbidities impact reimbursement. It's important to grasp how identifying the principal diagnosis and CC or MCC influences the entire coding process. We'll walk through the inpatient coding process, from the moment a patient is admitted all the way to the final bill. This helps us see the workflow clearly and understand where accuracy is crucial. Next, we'll discuss what DRGs are, diagnosis-related groups, and the different types of DRG systems used, along with how grouping actually works behind the scenes. Understanding these foundations is key to effective coding and reimbursement. Finally, I'll highlight what you'll learn throughout this series, ensuring you see how all these pieces fit together to improve your coding accuracy and optimize reimbursement. This slide ties everything together, emphasizing practical application and continuous learning in our coding journey. Every lesson in this series is designed to build on the previous one, so you don't need any prior inpatient experience to follow along. Whether you're completely new to coding or transitioning from outpatient coding, we meet you exactly where you are. We'll incorporate real UAE case scenarios to make the learning practical and relevant. As we progress, we'll explore advanced concepts like how coding directly impacts payment and the reimbursement process. We'll cover important rules for principal diagnosis and CC or MCC grouping, which are vital for accurate coding. Understanding the grouping logic and what DRGs are, along with their core types, is essential to grasp how cases are categorized. Our approach is from the ground up, starting with foundational knowledge and advancing step by step to more complex topics. This way, whether you're starting from scratch or refining your skills, you'll find this series accessible and comprehensive. Accurate DRG coding is crucial because it ensures that hospitals are fairly reimbursed for the care they provide, and that patients' records are correctly documented. Coders play a key role here. They determine the DRG based on several factors. These include the severity of the patient's condition, the resources used during treatment, and the procedures performed. All of these elements come together to influence the final reimbursement amount. Now, you might have noticed that sometimes two patients with the same disease end up with different hospital bills, and that can be confusing at first glance. But don't worry, that's not an error or a mistake. That's actually how DRG logic works in action. It's designed to account for differences in severity and resource utilization, which means bills can vary even for similar diagnoses. And I want to emphasize, it's not magic. It's a logical, structured process, what we call DRG logic. It's what helps hospitals get paid accurately and fairly, based on the specifics of each case. Understanding this helps us see the bigger picture, how detailed coding and clinical documentation directly impact reimbursement and patient records. Let's take a moment to look at how you can go from scratch to advanced in DRG coding with MedCode made easy. The key idea here is learning at your own pace, with new lessons added every week to keep you up to date. It's all about making complex coding concepts simple and practical, step by step. By subscribing and following the MedCode Made Easy series, you'll have access to clear, straightforward lessons designed especially for coders who want to work in UAE inpatient settings. This series is tailored to help you build confidence and competence in DRG coding, no matter where you are in your learning journey. So, if you're ready to start your DRG journey today, this is the perfect opportunity. Remember, consistent learning and practice are the keys to mastering DRG coding. Join us now and take the first step toward becoming proficient in this crucial skill for inpatient coding in the UAE.